Hey guys, Josh here. Welcome back to another episode of the SIBO Survivor show. In this episode, I'm really excited and I was fortunate to sit down with Jenn Gibbons. She's a functional medicine practitioner from New York. One super cool thing about Jenn is she actually likes to incorporate Kung Fu and help teach her patients a little bit about Kung Fu to help them calm their minds and stimulate their muscles. She's a Kung Fu junkie. She has experience as a military baby traveling around the world, learning different cultures and different ways of, living. So it's really cool. But the main thing we really dive into in this episode is just the importance of using a holistic approach to treatment, especially people with SIBO or gut issues when they have a chronic condition. It oftentimes helps to develop a well-rounded treatment program, one that's conducive to healing overall, and to incorporate practices like acupuncture, Chinese medicine, herbalism, using different herbs to help, the treatment protocols have success. And so Jenn uses these techniques in her own practice, and I just had an opportunity to sit down with her and kind of go through what they are, how she kind of approaches them, and how she has success as well, helping patients out. So super excited. Let's get it rolling. Okay, so hey guys, I'm here with Jenn Gibbons, a functional medicine practitioner from New York, and I'm super excited to have her on just to chat about alternative approaches to SIBO and how someone can effectively change their lifestyle and heal over the long term with this condition, because there's so much uncertainty. So I want to kind of dive into Jenn's background and learn more about her knowledge. So, hey Jenn, for anyone who doesn't know, can you just give a brief introduction of yourself?
Sure. I am a Chinese and functional medicine practitioner in New York State, both in the lower Hudson Valley where I live and have a local practice, but I also have a practice in downtown Manhattan in the financial district. And I also treat within the Federal Reserve Bank of New York's Wellness Center. And they have a full medical staff there. And so I'm lucky enough to be part of it. And my practice in the city is a little bit more pain-based and stress management-based, the typical city Manhattanite dynamic. And then my practice here more locally is a little bit more pediatric, because that's one of my other passions. Try to teach people how to swim versus saving them from drowning later, which is what my practice has been thus far.
Exactly, and it's so important to learn that, because like with the conventional model, a lot of times people come and they're just trying to like treat like a symptom, right? But we'll get into more of your approach and whatnot. So I saw that you have a background in Chinese and functional medicine, herbalism, and acupuncture. Can you kind of explain what got you into these alternative approaches to medicine, and how they differ from the conventional system?
Yeah. So I was raised a military kid and lived all over the world. So I definitely was a typical Westerner in the sense of conventional medicine. But then I unfortunately broke my back when I was 20, and it was supposedly due to poor bone density. And I had to have a pretty remarkable back surgery performed by the military. And they gave me my calcium pills and sent me on my merry little way. So about 3 years later, I'm working in New York City. I finished my bachelor's in psychology and was in between, school, not really sure what I was going to do with myself. And they had a local health fair, did my bone density screening, and saw that it was still what it was when I broke my back. So I started doing some investigation on how to improve bone density and saw the typical content about resistance work. So I was actually my whole life in a martial arts world, and looking a lot of my martial arts books, there was always this self-help section that was fixated on like Qigong and Tai Chi and acupressure. And I started reading about Chinese medicine through martial arts and became obsessed. So I enrolled at the school here in New York City, and 6 years later finished with a master's in Chinese medicine and herbal medicine.
Wow.
And that's what my personal experience, like most practitioners, is usually what gets people into the medical field.
Yeah, that's really interesting because I think a lot of people, kind of like your story, they go through some type of event in their life where, they have a health issue or they have a problem, and the conventional system, they're given something and said, hey, just go do this and it should be fine, and it usually doesn't work, right? So that's when
Yeah.
people start to search for answers and look outside of the box. So it's interesting, a lot of people are like that.
Yeah.
um,
Most of the practitioners that I know definitely have that kind of backstory.
yeah, so I want to dive a little bit more into like digestive issues, just because that's what a lot of my followers are struggling with. So
Yeah.
what is kind of your experience helping people with like SIBO or IBS or digestive type symptoms like those?
Yeah, so until I actually trained in 2016 with Chris Kresser at the Kresser Institute, I never had anybody reaching out to me saying, "Hey, I have SIBO. Can you treat me?"
Mm.
My patients were, in the city. They were mostly people coming to me, as most people do, come to acupuncturists is for pain, musculoskeletal ailments. Then they would obviously mention their digestive complaints and stress management, anxiety, mental, emotional type of issues. And since Chinese medicine, we call a lot of us Chinese medical practitioners in the functional medicine world call it the original functional medicine, because there is such a holistic approach about how you live your life in every facet, so that gets so much focus on how to repair your health, is in the sense of repair phase of the nervous system and making sure that it's turned on and engaged, whether that's quality sleep or stress management, mindfulness work, quality food, eating pasture raised versus conventional, non-GMO, and avoiding toxic load on the liver and the body. But this holistic quality that's just natural to function, Chinese medicine and now functional medicine, of course, was already part of my practice. So I was already helping people with that model. But then when I finished training in functional medicine, I had this addition to be able to do this diagnostic testing and integrate that also. But it's interesting because there's a lot of concerns with the quality of the testing and the results, and then also the treatment principles that are utilized. There's three major recommendations that you can utilize in something like IBS type symptoms with any kind of positive testing, whether it's a SIBO breath test or a comprehensive stool test, that you are taking a group of symptoms that fall in the digestive world, and you're taking testing information, and you're have this kind of eradication quality repair to the tract, and this diet modification relative to the stage of treatment you're in, whether you're gearing up in preparation for an attack, the attack itself, or the repair work after. And the thing that I noticed the most in treating digestive complaints is, like most people say, there is no one size fits all, that you really have to stage the person what their treatment principles should be at the moment and treat what you see. And if a patient comes in with a cold, I'm not going to say, well, whatever for your cold, I'm just going to work on your gut, because obviously you have to treat the cold. And that's really big in Chinese medicine, is treating what you see at that moment. And a lot of patients come in with a lot of pain, bloating, distension. Maybe they have constipation and gas, and they obviously are very uncomfortable. But how to alleviate that person's pain and discomfort, it depends on why they have it. If it's a lack of motility versus a weakness, like a thyroid impairment that's at the root of it, if it's scar tissue from a C-section or a surgery, or if it's literally cold accumulation in the digestive tract, or inflammation and heat. These types of root differentials are the key to Chinese medicine diagnostics. And what I would use to treat somebody's issue, like berberine, which is very cold and bitter, versus something like oregano that's neutral to warm, would be very different, because I'm considering that patient's physiology as the base.
Cool. Yeah, and I think that's important for a lot of my audience to realize, that, like, let's say the breath test can show some important results to kind of know what you're dealing with, but also, being able to work with someone like yourself who looks at more than just one diagnostic test, right? And saying like, what is this person's, what does this whole body look like? What does their life look like? And kind of being able to develop something specific towards the person, because it's hard sometimes when you just have a diagnostic test and you just try and kill based on that. So
And it's definitely getting more dynamic. We're learning from our experiences, like what we did 5 years ago in the SIBO world versus now is definitely a progression, which is moving much more and more to this idea that I'm describing that's innate to Chinese medicine.
Yeah. So that kind of leads me into, I just want to dive into Chinese medicine a little more, because maybe some people aren't familiar with that or other alternative approaches. Like, you have a background in herbalism and also acupuncture in regards to digestive disorders.
Mm-hmm.
So can you just explain kind of what Chinese medicine is and how that is kind of used in the treatment approach?
Yeah, so thousands of years ago, when people had complaints, you obviously needed a way without diagnostic testing to understand what to do for them. So it made sense initially, if you had pain somewhere, that the first thing you would do was massage it or warm it or, do something physical to improve it. So the first therapy really was massage. And then as we became to palpating the body and appreciating what pushing on this point does for me based on this symptom, we started to notate more areas that are a little bit more remarkable in response, and then giving birth to the idea of acupressure or Tui Na. So the advancement of massage, where you're having these consolidation spots that seem to be more remarkable. And then, we started poking at those spots and the birth of acupuncture, right? Yeah. And I mean, food has always been a root for all healing, because it's the substance to the body. I mean, of course, there's an energetics and there's an information component to it. Mark Hyman talks a lot about food being information. But there is the basis of, like, obviously something as simple as eating real food, but how you can play with food ratios. And you see this a lot in the SIBO world, eating, like removing complicated carbohydrates that are potentially going to be in aggregates and keeping the carb load down and such to minimize the sugar in SIBO. But in herbal medicine is really just an extension. Because if you look at the most nutritive dense foods, because obviously if you eat more nutritive dense, you can eat less, and then there's more burden, less burden on the digestive tract, so it can utilize the energy that it does have for the repair work that you're attempting to do. Yeah. And organs would be number one, spices and herbs are number two. So herbal medicine being a very nutritive dense type of food that has a very specific treatment principle that you can cater to where the person is at the moment. So if your motivation is to break up stagnation and purge the bowels, you can make an herbal formula with that principle. And knowing that the person's chief complaint is, abdominal bloating and constipation, but it's from a lack of movement, like the idea of the migrating motor complex not being engaged. And that formula is going to be very specific to that mechanism, versus just like this cold, bitter, move it out, like berberine or, other types of botanicals that are popular in SIBO, which is applicable when there's a heat component and you're trying to get rid of the heat so the system can work better. But they also have a lot of these anti-parasitic, antibacterial features that becomes the reason why there's so much focus on these herbs, like berberine type herbs.
Yeah, that's very interesting. So basically, you're kind of saying that as far as in the sense of herbs, like you can customize like different herbal formulas based on, what the patient presents with as far as symptoms and all those things.
Yeah, so one page on my website goes into this in pretty tremendous detail, because one of my goals as being part of Chris Kresser's academy is to teach people how to use herbal medicine a little bit more personalized. Because right now it's personalized in the sense of this person has positive hydrogen or methane SIBO, so we want to use berberine and neem and oregano and all of these allicin and such. Like we have all of these botanicals we know that are very effective. And so they're just playing with, chasing bacterium out and how dynamic they are to adjust to our treatments. So it's like this need to use a couple at a time and then switch it up and then switch it up and switch it up.
Yeah.
And it's a game of trickery. But there is no underlying patient physiology as a consideration. So like just palpating the abdomen to feel if it's cold alone can be a different, like, why does this person say a diarrhea? Is it because they're literally have cold in their digestive tract, which is there's a whole way of diagnosing whether or not it's cold in the abdomen versus inflammation versus stagnation versus damp accumulation, which could be a parallel to candida. So you can differentiate these qualities, and then the formulas, well, then you create a treatment principle based on that. So if I want to get rid of colds to resolve diarrhea, then I'm going to use warming herbs to improve that target the digestive system. Where if you have somebody with inflammation, you're going to use colder herbs that are going to get rid of the inflammation that is causing the symptoms. And that's a very simple way of looking at it. But the treatment principles now in functional medicine are, what are the testing saying and what ingredients do we know affect that? And then the treatment principle is to, build up the digestive system, repair the gut barrier, eradicate the pathogens, repair the damage done. And that is a treatment principle, but there's another layer that I think needs to be added, and it's the patient's physiology treatment principle. It's kind of like a base support, very much a parallel to, you can't really get much done if a person's thyroid is underperforming. You might need to enable the thyroid to work right in order to do the treatments and it be effective, and then work on getting them off the thyroid medication later if that's possible.
Interesting. Yeah. So that really, means that the doctor-patient relationship, especially in evaluating the patient based on what they're seeing, what their body is showing them, is really important too, and I think will be in the future.
Which is an interesting dynamic to virtual sessions. Yeah. A lot of practitioners will just Skype with you and do a consult and look at your diagnostics and will write up a treatment plan for you. And they will never have even seen you physically or assess your body, which a lot of them, it's going to be successful to a certain degree, but it's like you're also missing a layer that could be part of the treatment.
Yeah, it's almost like it's showing us that we need human connection, right?
Yeah, how do I know if you have a cold abdomen if I don't feel it?
Yeah, exactly. So next thing I want to kind of pick your brain on is acupuncture. So a lot of people don't know what acupuncture is really, and it's another, alternative treatment method. Can you kind of explain what it is and how it can be used to improve health?
Yeah, I like actually Chris Presser's definition because, he is an acupuncturist by his background. Mm-hmm. He talked about points being an accumulation of neural and vascular tissue. And so if you kind of had these accumulation points along a trajectory that you could physically stimulate, then it would make sense that would be more profound than, say, a point that's only an area of the body that's, say, an inch away, of course, relative to where it is. But, acupuncture is really cool. It's pretty remarkable what you can do with it. I have people that come in with low back pain and their back is really stiff, but it's like cold to the touch. They feel really rigid when they first wake up, or they've been sedentary for a while. So they literally need to get their circulation going in order for them to feel better. Mm-hmm. So I obviously want to do a lot of work to warm up and stimulate that zone, right? And so acupuncture can be used to ignite interaction with the body to that area, to bring in the immune system, to get the brain's attention, to increase circulation locally, pairing that with like far infrared therapy and massage, even a potentially electrical stimulation in certain situations on the needles, versus like somebody that comes in with like a hot disc, they just threw their back out and their back is like inflamed. If I was to stimulate locally with acupuncture, I would be bringing more energy to the area that's already really angry and congested, and it would aggravate them. So I am pretty much like a plumber in the sense that I can locate their pain and say, okay, well, it's on this particular pathway from the midline of the body, and I can work distally in the legs, and I can literally drain it, like draining a plumbing line. And so acupuncture I mean, in the sense of digestive issues, you take that same parallel, that idea of that patient with that cold stomach. So if you were to stimulate an area that's cold, you're going to be more metabolic, and therefore you're going to warm it. So you could do a lot of local needling around the abdomen and points that are known to stimulate that area distally, and add the far infrared heat lamp, do abdominal palpation and massage, and you could really have a patient walk out with a warmer stomach. You could pair it, obviously, with a lot of herbal recommendations and even dietary recommendations that would be complementary to the treatment principle.
Yeah, and then also like for digestive problems or like functional issues like SIBO is can it also help with like the motility, the movement, the function of your digestive tract? Yeah.
Yeah, there's one of the most popular points on the body called Zusan Li, is right below the knee and on the tibialis anterior muscle, like the top of the shin bone. And this point has actually been proven to stimulate the vagus nerve, which is a very important nerve for gut motility. So I'll actually stimulate this particular point and do a single stim unit on it, where I complete the circuit by touching the patient and get the increased sensation. For people that are very deficient and weak, I'll do the far infrared heat lamp on the point, or an herbal therapy called Moxibustion, where you're burning a particular herb over the point. The point is this is to excite stimulation, and if that person is more deficient and weak, doing more warming and invigorating is going to be beneficial to them versus somebody who is a little bit more inflamed and dry. Then I wouldn't be, doing all that added stimulation. I would be a little bit more minimalist with them. But yeah, you could also do scalp acupuncture, auricular, the ear. There's a lot of ways to stimulate the neural connections, balancing the autonomic nervous system, the sympathetic and the parasympathetic via auricular. Yeah, so there's a lot of ways to affect the migrating motor complex, which is considered one of the main reasons why people have SIBO, especially recurrent SIBO.
Yeah, and I think using techniques like acupuncture and other forms of body work, I think, are going to be an instrumental part of the treatment process going forward as well, because
it's a hot topic right now on a lot of the chat boards and the Facebook groups is about the abdominal work. Because the SIBO summit that they just hosted, the second one this year, gave a lot of emphasis on working on breaking up adhesions. That was the root reason why they anticipate SIBO for that patient.
Yeah, it's interesting. Yeah, because you need to get the function, the digestive tract moving correctly. Yeah.
I have women that get tummy tucks and they get that scar across the lower abdomen all the way across, and it's just like, my emphasis is on, obviously not, they're in an aesthetics world, but I'm thinking about gut motility. It's like I got to break up that scar tissue and avoid it being a really remarkable scar,
Exactly. And then one other last question about acupuncture is like let's say you suggest this to someone, or you're going to be treating someone using acupuncture, like how often do you do the treatments? Every few weeks, or what does that look like?
Yeah, that's the annoying component of our society now, is because traditionally, you went to the village acupuncturist all the time, and they were the one that got yelled at if you got sick, like you were to keep them well, right?
Okay. Yeah.
Now we're on the other side. We use things for when we are not well. And I used to work in a physical therapy office for 8 years, and that model is like 2-3 times a week for a month, reevaluate, possibly another twice a week for a month, and then probably discharge. And in a very musculoskeletal sense, you're really trying to avoid the body's regression to what it was before, because it really likes to go back to that comfort zone. And that's very typical in physiology too. So, the more you do it in a short duration, obviously the more profound it's going to be. And a lot of these treatment principles are based on high frequency. So when you have people say, oh, I went for acupuncture, they went once a week at maximum, it really wasn't designed to work that way, which is why community-style acupuncture clinics are necessary and popular, because who could afford $100 and something a session, and doing it more than a couple of times a week for sure. That's a lot of money.
Yeah, definitely. And I think it's a really important point you kind of just talked about too, is like designing your life like they did back in the day in a way where it's like preventing disease, right? Like you're establishing a routine that's working to keep you healthy and prevent disease. Yeah.
Well, I'm in Manhattan, so there's no work-life balance here.
No.
So it's hard to kind of wrong the patient for their lifestyle, which is why this all-encompassing quality of like people need to counterbalance all the sitting, and they need to calm their stressed mind, and they need to turn on their parasympathetic nervous system, and they need to find joy so they can continue to work more than they should. Yeah. And that's why you need that all-encompassing system, which is why I love internal martial arts so much, because that's exactly what it provides.
Yeah, it's like we need to get to that point at the beginning, right? And live our lives that way. So
it's like we're gonna eventually switch over to the other side.
Yeah. So for any SIBO patients or people watching, what kind of, if they're struggling, what kind of outside the box advice would you give someone with your different backgrounds in these different types of medicine? What would you suggest?
Yeah, I kind of stage people by severity. There's people that are coming in and they have aggravating symptoms, but they're able to just perform their day-to-day routines and move towards an improved lifestyle. And you can do this more gradually with them. And in those types of people, I don't really jump to testing. I just start treating what I see in a Chinese medical principle. And, that's the nice thing about Chinese herbs is you continue to work towards improvements, part of the diet and lifestyle work, without needing to be in front of the practitioner and getting like acupuncture. And then, for people that are more uncomfortable, that can't really function day in and day out, then I give them options to say, well, here is the Chinese medical approach to treating, bacterial overgrowth, fungal, parasites, infections, herbally. And here is the functional medicine model, and the pros and cons of both. And often it's the financial component that really dictates which path they go on, because Chinese herbal medicine is remarkably less expensive than functional medicine, unless you have, say, like you get a positive SIBO test and you can get your GI doctor to order like rifaximin and neomycin and be paid for your insurance. And then you can obviously see remarkable improvement in a short amount of time, but you could also do the elemental diet in the same duration of time and see an equivalent amount of improvement. So, a lot of people are pro antibiotics in New York City. They're not uncomfortable with them. So where you get a lot more holistic minded people that I get through like Chris Kresser that are a little bit more, they're coming to me because I'm not a medical doctor, and they're looking for the botanical side because they have an aversion to the antibiotics. Yeah. So it's kind of relative to how uncomfortable they are, and also how financially sound they are willing to spend money on, and the duration of the treatment too, because herbal is definitely going to take longer, the traditional route, because it's definitely working with your body versus attacking as much. Mm-hmm. So it's like work on it, fix a little, work on it, fix a little, versus attack.
Yeah. Versus nuclear war. Yeah. It's funny.
It's so relative. It just really depends on the person, and I can give them a perspective. But outside of the basic 4 pillars of schedule 8 hours and don't stay stressed out all day and work to counterbalance stress, and don't sit on your butt all day. You got to move. Yeah. And then obviously adopting an anti-inflammatory diet without conventional food and genetically modified ingredients. That's all kind of baseline standard for everybody. Mm-hmm. But if somebody has a lot of muscular tension because they're more rigid, I'm going to push more the lipid-based stuff like cod liver oil and the vitamin D and the magnesium like glycinate to relax the physical structure, versus somebody that's more like cold and doughy, like more adenomist-like, then I'm going to be pushing more of, the movement and the warming and building quality and purging fluid accumulation. So a lot of their treatment principle is based on their physical body, which is, very unique to Chinese medicine. So without really seeing somebody like that, you could do a lot of generic things like L-glutamine and zinc carnosine and the vitamin D, the vitamin A, the quercetin. These are all going to work on improving the whole digestive tube structurally, whether it's, the idea of leaky gut, or you're working on epithelial cell repair, because it's really hard for that in terrain to really work right if it's really agitated. So you need to give it a little love a lot of times first before you can start beating it up again.
Yeah. Yeah, it's interesting how our brains work sometimes, where like people want an overnight solution, but then like in the long term they realize that it's like that only works for a certain period of time. They're going to need to incorporate more of a holistic approach like you've talked about.
Yeah, definitely.
So lastly, where can my audience find you to kind of learn more about you or to get in touch? And then do you offer like Skype coaching or?
So I'm in New York City in the financial district, and then also in the Lower Hudson in the town called Beacon. My website, JennGibbons.com, JENN Gibbons.com, has my 2 locations. I do Skype consults for obvious like nutrition work and diet and lifestyle work, but obviously not acupuncture.
Yeah.
I am able to write prescriptions for herbal recommendations based on a robust history, and also, which my intake paperwork online is over the top for most functional medicine practitioners, because Chinese medicine is so much more about distinguishing symptoms into these different dynamics, like the cold versus the hot, the dry versus the damp, that kind of idea. And so I can look at somebody's tongue and get a robust history and make herbal recommendations and do that stair-stepped. So yeah, that's the best way. It's really designed for people starting out, because you look at my patient base, a lot of these New Yorkers are just not aware of a lot of this world. They're seeking me out in a different dynamic, and I'm making them aware.
Yeah.
And obviously, since I did Presser's training on the functional medicine world, I'm having a lot of patients seek me out via his directory that are going straight FM, but they tend to be local people, so they're still able to come in.
I think it's important for people to realize the different types of medicine and the alternative approaches they can take, because a lot of people, the conventional model fails them. So it's good to understand.
Yeah. And that's one of the biggest things right now is it doesn't matter if you're a medical doctor, chiropractor, a naturopath, a nurse practitioner, a health coach, a nutritionist, an acupuncturist. All these people that are meeting in the middle with functional medicine, they're going to get you better. They're just going to get you better from their background. And you can't judge what somebody knows by their license anymore. I mean, I know some pretty remarkable medical doctors and registered nurses that have done a lot of time training in herbal medicine and, mindfulness work. And it's pretty profound what they're doing too. And so you can't get really fixated on the license anymore. You really have to say, well, what is your approach? Yeah.
Awesome. Yeah. Well, I appreciate you coming on the show. Some awesome information for my audience to kind of learn from and to help them on their journeys. And just thanks so much for stopping by.
Yeah. Thank you so much, Josh, for inviting me.